Hi, Pam. Thank you very much for allowing me to conduct this purposeful interview on how we are doing as a group in the Children's Hospital at Dartmouth. I'm going to be asking you four specific questions surrounding four pillars in our practice on compliance and people relations, attracting and recruiting, onboarding and alignment, and learning and development. But first, can you tell us your role and how many years of professional experience are you giving us here in the chat?
So I am the nurse coordinator for the Child Development Program in the Pediatric Clinic. I have had that particular role for 5.5 years, and I have been a total here at Dartmouth Hitchcock for 18 years. I started out in the general pediatric clinic and worked there for 10 years as a triage nurse on the phone and as a clinical nurse in the clinic. I transitioned to care management for 2 years in the PD and PICU area, and then I came back to work in the more specialized clinic of developmental pediatrics.
Oh my God, I think I chanced on the most important person to be a respondent in this interview, because really and truly with this 18 years of experience that you're giving us, you breathe in and out pediatrics and the child populations,
Right.
and you've seen the trajectory of our growth from day one until now that we are, I want to say, post-pandemic now, although we still have it, but you have seen our ups and downs and our status quo moments. So let's talk about the first pillar, which is the compliance and people relation. Tell me about a time when you were in conflict with either with a colleague or a patient you were interacting with at the DH Children's.
Oh my goodness. So for over 18 years, there might have been one or two in both areas. In bringing to mind one particular time, there was a provider that had an issue.
Mm-hmm.
And we were short-staffed that day, and I happened to be the lead nurse that day to take care of everything that was going on in the clinic, and the provider was quite angry and upset things were not going as they were usually going. They did not have their same staff, so things were being done a little bit differently. And I was asked to go and speak to them, and I went and I said, "How can I help you?" And all I heard was the complaints about how things were not being done. And I had to stop and say, "Can we just stop right now and ask, what do you need done right now? I am here now to help you with whatever you need done right now for the patients. I can't correct everything that's just happened. I can only move forward and help you now." And come to find out, that wasn't necessarily the most important thing. So that was a little frustrating. And a day where we had to really manage our tight resources, we really had to focus on what needed to be done and not, a venting session. So that was a little uncomfortable.
It is. But
Right.
In looking back at this particular situation, what were the support available for you, or was there anybody that supported you get through that particular difficult situation? And share to us how that could have been avoided or mitigated. But
I don't know that particular day I had support. When my nurse manager returned, I was able to, discuss that with my nurse manager.
Okay.
Because they weren't there that day, and maybe that person would have gone to the nurse manager instead of me as a nurse, a clinic nurse that was not responsible for what was going on. I was just trying to help that day. And sometimes that's what needs to be done. When you work with what you have and you get done what you need to get done. And, maybe that would have been nice if I had someone that I could have referred that provider to discuss their concerns at a later date, or just asked, communicated a little bit better about what needed to be done right then and there, and especially because this happened in the hallway where there are patients, right? So, that probably had I had time to think about it, I might have said, if I knew what was going to go on, can we discuss this in private and not let others hear about what's, and see that we're having difficulties, that
Right.
type of thing.
I'm gonna poke a little bit more, Pam, knowing that you also have this dual role as a chair of the practice governance, and in your role as the chair, you get thrown at frustration, changes that we would want to effect, uh, wish list that nurses wanted to do. When you are dealing with your colleagues at the practice governance and your senior leaders, um, how are you supported in your role as a chair of practice governance?
Well, I am supported by the nurses that I work with. I'm supported by the leadership, but I do feel like, there are greater and lesser amounts of support being given. I do feel like my nurse colleagues are a little bit more stronger in their support because they kind of know where I'm coming from. It's a collaboration. I'm not able to make decisions unilaterally, so I have to collaborate to get things going. And sometimes the decisions, with leadership, we may differ on timelines or what should be prioritized, and that can get frustrating because, I may see where the next best step is, but I can't seem to relay that to the people who would help me make that next best step, right? Right, and I am representing the other clinical nurses here at Dartmouth Hitchcock who are looking for a change, and, the ideas are there. We just need to keep pushing forward and getting our priorities looked at.
Especially that during this time, everything is a priority, right?
Mm-hmm.
We have had this discussion about the time and our protected time being reduced further, and not at the moment, but there is a talk about that. When in fact, if we look at other organizations, our roles as a DEI specialist and as a chair, this is a full-time job.
Right.
If you are given the liberating magic wand to fix this, how would you envision your role as the chair of the practice governance?
I would see that I would have more time to engage with more clinical nurses. Right now I have a limited time, so I can only prioritize what I need to get done. In that limited time, I would be able to hear maybe more voices and more different forums and more situations if I had time throughout the week instead of just a structured day or so that I am able to do. I would be able to collaborate with more people on different levels and really get into projects. Right now, it's really easy to come up with the ideas and then we aren't able to follow through. People change, times change, and priorities change. And so, if I do find it hard switching from role to role, one day I'm doing this and the next day I'm doing my clinical work, and some days my clinical work does take priority because we have needs that need to be met in our clinic. And
I think you belong to that elite group that has mastered the jack of all trades.
Right. And yes, so I would like to think that, we could provide more support to nurses if we had a full-time team that was working on this. Day in and day out, we could get more real-time feedback about what's working and what's not working, and be able to adjust a little bit better than waiting a month at a time for meetings and things like that to go on.
I think that's important that, we are still continuing to persevere and do that, and we're not giving up the leeway to take the protected time away from us, because the work that we do is really important. So now I'm going to be shifting to the next item on our list, which is attracting and recruiting. And so, I don't know now the formulary in retaining our staff, because we are all, and this is not unique to our organization, we are losing staff day in and day out, and the best and the most learned people that specializes recruitment and retention are also scratching their heads. So then I want to take you back from the time that you joined Dartmouth. Tell us about your onboarding experience.
So I was hired 18 years ago by a nurse manager who I'm still friends with today. She no longer works here. I had applied for several jobs at Dartmouth. I worked in other places in the community area because of the salary and the alignment with what I was looking for. I came to Dartmouth Hitchcock. I worked in a community agency where I was the only nurse, and I felt really strongly I wanted to be more supported by my nurse colleagues and have my work driven more by nursing structure, because I did not feel well supported in what I was doing as a nurse without any other nurses around. So I came to Dartmouth Hitchcock. I was hired in the clinic, and I was welcomed. I felt like part of the group, part of the family. They were a great team. I don't think I learned everything right away, but I do remember that I worked for 2 months in one area, and then we all moved in August of 2004 to the doctor's office building, which was very stressful. So we all kind of were levelized at that point of not knowing where anything was, because as a new employee, I didn't know the routines or where things were, and now everybody was kind of in that place.
Right.
I feel like my leadership skills were recognized, and I was brought right up to being a charge nurse and trying to do, to do that role while I was still kind of new to the whole clinic nursing. But I had some really great colleagues and mentors that had been here before me that were able to provide that support and education. And that group of people, we still get together today socially, even though they've moved on and retired. We had such a great group, and life happens and people move on. And as I wanted to learn and develop, there were ways that I could and ways that I felt held back in the clinic. So as I was looking to progress my career, the care management position came available in pediatrics and PICU. And so there were also things going on in the clinic that were very difficult for change at that time, as service lines were changing, and we were coming under a different service line and different management at that time. So it was a good time to look for something new. And then I went to care management, and I had the experience, but things changed there. Again, things keep changing, and I realized as I was being asked to do different work that I really was a pediatric nurse, and that I really wasn't cut out to work with adult patients in different services, that I wanted to stay in pediatrics, and that, part of my satisfaction was working with a team that really got along together, and that I looked back to coming back to my own clinic for a different role this time, because I really wanted to be part of that team.
Right.
And so I came back 5.5 years ago, and leaders have changed, but the same core tenets are there. We are just a team. We do support each other, and I am proud to be part of CHAD. We go to different events or different educational offerings, and it really does feel like the right fit because of the way we are based, we in all the teaching we do, and the care for children that we do, and everyone is on the same page for taking care of the children and the family in a patient and family centered way.
Right. I just want to call out that recognition that you have received from your colleagues, and up to this date, Pam, your leadership skills is really up there, and we see it. I see you as a leader and a partner and an ally, but it's such a great feeling to know that as a leader you're still there, and you're wanting to mentor other people in the same manner as you have been mentored. Because it sounds like in your explanation you have had mentors that you have struck a relationship with until now, and it has grown into a friendship in and out of the workplace. So then, I want to ask you, what do you think would be the CHAD's capital or seed in really attracting, well, first of all, recruiting people? How can we best do our recruitment process?
Oh, that magic wand, right?
Right.
Right. If I had a magic wand, what would I do to attract people? Well, I would tell them that we are a team of multidisciplinary professionals that work very hard to provide care for the patient. One of the reasons why that move happened all those years ago is they wanted all the specialties to be in one area. We didn't want patients to have fragmented care, and I think we work really hard so that we can provide a continuity of care with all the providers that take care of a child. Some children have many providers, and we try to coordinate appointments, we try to coordinate testing, coordinate things so patients and families don't have to go through so much to get their care. A lot of work is done behind the scenes to get answers for them, without having to delay or wait for another appointment, because our team works so collaboratively together that it's really easy to get that communication. You just send a message and you get an answer back, and the family gets their answer, and everyone is satisfied with the outcome.
Okay, so we have got that. We have the battle cry for, come work with us, because we're not only a multidisciplinary expert team, but we also provide a holistic, non-fragmented care. Retention.
So that is another hard one. Why do I stay here? I stayed here for the culture. I stay there because I enjoy helping work with the patients and the families. I've always wanted to keep my hand in patient care. I never wanted to change jobs where I didn't have a hand in patient care, because that's very important to me, to be that voice with the patient and helping them. But why I stay, the things that I would like to see, I mean, money is one thing and that's lovely, but I know that that's not the only thing. The things that would keep me here is, the things that make my work-life balance better. Things like scheduling, flexibility in hours, prioritize decision-making, like in terms of time off and things like that. That might be more important to a nurse who's been here a long time as opposed to the salary.
Right.
Things the pandemic brought to us is working remotely. We never thought that some nurses could ever work remotely, and then we found out, wow, for some roles that really does work, and it really works well. And that is a really nice benefit that I have taken advantage of at times, and I know other nurses have appreciated, without feeling like we're not still part of the team or giving good care.
Okay, here we go. We've talked a little bit about the onboarding and alignment, but let's just be specific about what's the best and the worst part of onboarding a new staff in Tartman or in chat.
The best is when you do a comprehensive, I think, assessment of where they're at. Have they ever worked here at Dartmouth-Hitchcock? Have they ever worked with pediatric patients? Have they ever worked with patients in that particular specialty?
Okay.
Where are their strengths and where are their weaknesses? And, I talk about team and family. Introduce them to people. Get them to know where things are. What is the culture here? I recently, a year or so ago, had to help a new nurse, and I said, oh, well, has anyone showed you around the clinic? No one thought to even do that. The first day I show people, this is the place, and this is where the people are, and you're going to find these people here and these people here, and the important places, like your break room and your bathroom. And every Wednesday morning there's grand rounds, and we encourage you to do that. And we have a staff meeting on this day, and we participate in this. And
so then I know now what's the worst. We don't have that manual that tells whoever is doing the onboarding that, okay, these are the things that you need to tell your mentee or your person to be onboarded.
And the worst things, is just not making them feel welcome, or not making them feel bad if they have a knowledge deficit in some areas. Like, we have to teach them. We all had to learn, so we all have to take the time to do that. And, orienting nurses and precepting them is very time consuming. You get behind in your own work because you have to stop and teach every little step.
And we don't factor these things sometimes, right? We don't factor that, okay, you don't get alleviated from your other roles when you are orienting. Now you have two jobs to do when you are tasked to onboard someone.
But if you do it correctly, then they're going to be high functioning member of the team.
And that's always the
right. If
end
you
goal,
don't,
right?
then they're constantly going to be asking questions and not, able to pull their own weight, right? So if we do it right the first time,
Then you're all
right.
set.
Recently, I was able to orient a per diem nurse to my role, and we spent a lot of time for 2 days, and she's doing an excellent job covering for me during my shared governance days or my days off. But that really makes me feel good that I know that I can leave my
There
team.
goes your ROI. Have you returned on it?
Right, but then I know I can leave my team in good hands and feel comfortable about being away from the clinic when I need to be.
Okay, so let's talk about the learning and development opportunity, okay? Can you share how DH Children develop you as a person who teaches other person, or as a person that we go to as an expert on this particular role that you are doing as a care management?
Let's see, how did DH do that?
Were you given enough trainings? Did we send you to appropriate
Well, yeah, there's
training?
never, I think we highly value professional development in our clinic. So there's never been a problem with going to and attending any continuing education, grand rounds, conference. We used to have classes, lunch and learns before the pandemic, where we'd all get together about a topic and learn. We'd learn about each other's roles, and we do a cross coverage, like, so we can help out other teams when they need helping out. We also encouraged certification a few years back, and I was able to get my certification in pediatric nursing. We held classes for that weekly for several months to help people study.
To prepare them to
prepare
get the
them to sit for the exam, right? So I do feel like the role of professional development and learning has been really emphasized and facilitated.
In the children's. So Pam, it's only quite recent that we have been moving into illuminating the importance of diversity, inclusion, belongingness at the organization. How important is it to you to diversify our workforce?
I think it's important because that's how the world is. I don't think we should be insulated from what the rest of the world is like. We are dealing with people as patients that come from all walks of life. And I worked in a community prior to this that was a little bit more homogeneous in terms of its community members and their education level and their socioeconomic status, and there wasn't much diversity. And when I came back to Dartmouth Hitchcock, I was like, wow, this is wonderful. My patients are all very different. The staff I work with, working with residents and learners, they come from all parts of the country and other countries. And so that was really, really nice. And to get their perspective on how, there are so many cultural differences that we're able to, recognize and learn from by working with other people of different than I am, and different even what some of our communities are.
All right, one last question, Pam. Engagement.
Mm-hmm.
How do we do this?
I don't know. I wish there was again a magic wand or pill to give. Why am I engaged? If I'm going to be at work, I want to do things that are meaningful to me. That's pretty much
replicate
right.
it.
So, I have my job to do, and that's satisfying, but I also wanted to do more. If I have free time, or if I have other things to support nurses. And I feel like, being engaged in practice governance was very important to me. Other people are engaged in other projects.
Right.
It really, I think, makes a well-rounded person to be able to do that. And I think you can get out of things what you put in. If you're not going to leave your office and leave your silo or leave your unit, you're not going to meet the right people that can make, your life so much more enjoyable at work. Through my shared governance work over the years, I've been able to meet people from all over the hospital I might not have met because I worked in CHAD. So, I've met nurses from every department, and I've been able to meet people in the leadership roles, and, it's really nice.
Okay, here we go. Fill in the blanks, Pam. I am Pam Rice, and I'm proud to be part of CHAD because
we give excellent patient and family-centered care.
Thank you, Pam.